Democratic Republic of Congo is facing its worst Ebola crisis ever, as the deadly virus continues to spread at an alarming rate. The latest reports indicate that more than 2,500 people have now died, with health officials warning that the outbreak is growing faster than the response effort. The situation in the Democratic Republic of Congo is becoming increasingly desperate as the country battles its deadliest Ebola outbreak on record. According to the United Nations Senior Ebola Coordinator, the outbreak is spreading exponentially, with more than 2,500 deaths recorded. Even more alarming is the speed at which the deaths are occurring. Officials say about half of those deaths happened within just the last 20 days. The outbreak has now spread across several provinces in eastern and northeastern parts of the country, covering an area described as larger than France. Health authorities are particularly concerned because the outbreak is being driven by the Bundibugyo virus, a strain that presents major challenges for medical teams.
We don't like the trajectory of this outbreak, and it's already the second largest outbreak in the world. But if we take a photo after 14 weeks of declaration, it's the biggest outbreak, 7 times more than the West African outbreak. We cannot continue like that.
The current outbreak has already surpassed the previous record for Ebola cases in the Democratic Republic of Congo, which was recorded during the 2018 to 2020 outbreak. The crisis is also unfolding in areas affected by armed conflict, population displacement, and weak health infrastructure. These conditions are making it extremely difficult for health workers to identify patients, trace contacts, and provide treatment quickly. And there is another serious challenge. Health workers themselves are facing attacks and insecurity while trying to respond to the outbreak. The United Nations has condemned the violence, warning that attacks against medical personnel could further weaken efforts to contain the disease. International organizations are now racing to strengthen the response. The World Health Organization and its partners have announced plans to send 70,000 doses of the Ebola vaccine to the Democratic Republic of Congo. However, officials say the vaccine was developed for another Ebola strain and is not licensed specifically for the Bundibugyo virus. Scientists are therefore studying whether it can provide protection against the current strain. Meanwhile, health agencies are calling for more funding, more medical personnel, and stronger community cooperation. The United Nations has warned that current funding could run out within weeks unless additional financial support is provided. Officials say the goal is not only to treat infected patients, but also to identify new infections quickly and prevent the virus from spreading into additional communities and neighboring countries. The situation has already attracted international concern, with the World Health Organization maintaining heightened surveillance because of the risk of cross-border transmission. For millions of people in affected communities, the outbreak has created fear and uncertainty. Health authorities are urging residents to cooperate with medical teams, report suspected infections, and follow public health guidance. The international community is now facing a race against time. Provide enough resources to slow the spread before the virus moves even further. The Democratic Republic of Congo is facing an unprecedented Ebola emergency, with more than 2,500 deaths reported and the outbreak spreading rapidly. Authorities and international health organizations say urgent action, funding, and cooperation are needed to bring the crisis under control. This remains a developing story, and further updates are expected as health officials continue their efforts to contain the deadly outbreak.